Humanitarian journalism.
Bismillah ar-Rahman ar-Rahim. Welcome back. It is just gone 8:55 a.m. This is News and Views with me, Julie Ali, and another amazing woman on the show this morning on this amazing day, Women's Day, where we celebrate women that have really made strides in their field of work. One such woman is Dr. Regina Hurley. She's based at a hospital in Newcastle, and she's going to talk to us about how she got there. She's an anesthetist. Let's get her to tell us what exactly is it that she does there. Let me just get my paperwork all in order here. So she works in general anesthesia, pediatric and orthopedic anesthesia. Not only that, she is also she practices exclusively at Mediclinic Newcastle and is in a temporary acting clinical hospital management position currently. And over and above all of that, she's busy with some research, very interesting and exciting research. She'll talk to us about that. And she also goes on to say that in the near future, there's a possibility that cannabis or marijuana will be one of the amazing treatments or modalities that one can use in the treatment of COVID-19. Let's welcome this amazing woman to the show this morning. She truly is a mover and a shaker, Dr. Regina Hurley. Good morning, welcome to the program. What an honor to have you on the show.
Good morning. How are you? I'd like to welcome everyone to the show today on Women's Day. Assalamu alaikum. How is everyone today?
Wa alaikum assalam. With your duas, we're all very, very well. Now, your husband is also a medical doctor. I presume you're both at the Newcastle Mediclinic.
He actually does more business now than he does medicine.
Okay.
His foot in the door, especially with the cannabis projects that we've been doing lately. Yeah, we actually met in America, and 13 years ago, we moved back here to South Africa. And since then, we've been really pushing the cannabis project, as well as all the other interesting topics that we can talk about today.
Okay, we've got time constraints. I would like to get you back on the show another time as well to have a really long discussion. But for the purposes of today, we obviously accolade you as a woman of substance. I guess we all are. We all have something to give back to communities and societies, but you're involved in a very interesting piece of research. I also understand you're one of the very few, possibly the only person in South Africa who's got a license to cultivate cannabis. That leads me to my question: how come we see a lot of pop-up stores in all the malls selling cannabis oil? How legitimate is that?
Well, most of that is being imported from other countries. So we actually are cultivating and manufacturing and processing local here in South Africa. So that's what my husband and I, Dr. Jamalodeen, have been really looking at since 2017 to try and up the community and the businesses here in South Africa, not importing it from other countries. We also have hired about 100 women to work on our farm. So during the cultivation, all of our cannabis is handpicked by local women, processed by local women here in KwaZulu-Natal. And we really feel that this boosts the economy, it boosts women's confidence, and it helps with gender-based violence. Because as the woman now is bringing in an income, they also have more support in their family and a little bit of a more say in their family, which also decreases the violence that we see on the local women here. We have women that come, they have been working with us for the last couple of years with all aspects. We have improved their knowledge and given them a new skill. So we have upskilled them as well. So yeah, this is all very, very exciting, and we're really looking forward to the future. We're working very closely with government. As you said, we had the first piloted program here in South Africa for cultivating of cannabis.
Dr. Hurley, you are an anesthesiologist in different, obviously, fields of your medical background, obviously. What drove you, or what created the interest in the cultivation of cannabis, and then to start your research into the healing properties of cannabis, very especially now with COVID-19?
Well, as an anesthesiologist, we work very closely with pharmacology and the dynamics of the different medications on the body itself. So what we find is a lot of the medications that we give as Western practitioners, it's actually not helping the body heal itself. Whereas when we look at the cannabis itself, mostly the CBD, which is the non-psychoactive component of the cannabis, we find that it actually works on our innate endocannabinoid system that everybody has in their own body. So what this does is it resets our endocannabinoid system, allowing our body to essentially heal itself. So we have looked at this, especially with the COVID-19 pandemic. In other countries, Israel, United States, UK, they have been doing extensive studies to see how CBD can actually help the body against the COVID-19. They have seen that patients who are already on so-called medical cannabis or using CBD as a health supplement daily, they actually had a lower infection rate of COVID-19. And they actually found that if they did get COVID-19, their symptoms were less severe. CBD helps with the cytokine surge that I'm sure everyone is used to hearing about. And it also helps the lung with the inflammatory process, and it helps the clotting that we've seen a lot of the side effects of COVID-19. So these are all very, very interesting topics that we're looking at. Our original research started with the abuse of opioids and the abuse of pain medications. We have found that CBD affects the same receptors in the brain that narcotics do. So as people say they will become addicted to cannabis, it's actually the opposite. We're looking at cannabis as actually reducing the opioid use as well as the other narcotics that we have seen. So there's very, very interesting new research being done. And since COVID is a new disease, we're really in the forefront of the treatment of the cannabis, of the COVID with the cannabis.
So as we speak, Dr. Hurley, are you already administering cannabis as one of the protocols against COVID-19 or in the COVID-19 treatment?
Well, we are, as per SAPRA, with being a health supplement, we are guiding people to use it. We're looking at it as a prophylactic as well as a reduction in the cytokine surge and the inflammation that we see with COVID. We are trying to get people to use it prophylactically, as well as patients who are in the COVID surge who have tested positive, using it for a number of anxiety that they get with the COVID. I'm working closely with a life coach who is helping a lot of the patients post-COVID with the anxiety that they feel after having gotten COVID. So we're seeing many, many uses, different compositions, different strengths, depending on what the symptoms are. When they are in their full COVID, then we increase the amount of the CBD that we're giving them. If it's a prophylactic treatment, then we are just recommending a lower dose. So yeah, it's very, very exciting, and we're really looking forward to some of the outcomes. At the moment, it is what we would call an observational research, where it's really just the patient that's giving us feedback to tell us that they're feeling better, they're sleeping better, their anxiety is less. And these are all the things that we need to look at with COVID. I mean, it's been a very bad 18 months, and we've really seen that the COVID has improved the patient's quality of life in general.
So let's go back to the CBD in terms of we're focusing on COVID because that's the big news at the moment. I mean, the whole world is in the grip of this pandemic. But what other illnesses or diseases can can the cannabis CBD oil assist in healing the patient? And then you've also spoken about using it as a preventative, a prophylactic. People watching and listening to us this morning might go out and start buying up a whole lot of the CBD oil and start self-treating. What cautionary advice will you give to them?
Okay, yes, we have seen benefits in a full range of diseases from diabetes, hypertension, cancer, pain medication. These are all things that we've seen benefits in, and there's full research being done all around the world. Unfortunately, South Africa, we haven't been able to do full research, due to other reasons and constraints that we have here. But we have seen a reduction in glucose for diabetics. We've seen a reduction in patients who have high blood pressure. They've been able to reduce their amount of their amount of tablets that they've been taking. With patients with cancer, we need to be very careful. I actually had a lady phone me the other day. She has breast cancer, and people need to realize that breast cancer responds to CBD, and actually giving THC, which is the psychoactive component of cannabis, can actually harm some patients with breast cancer. So the CBD use in cancer can help with the reduction of the cancer cells replicating. It can help with the side effects of chemotherapy if the patient is on chemotherapy, can help with the nausea related weight loss, different aspects of the cancer. I think the biggest thing that you need to be aware of if you're going to start treating yourself with cannabis is you need a guideline. If you're going to take it prophylactically, it's fine. If you're going to take it for specific reasons, you need to look for a cannabis physician or a specialist who's actually done research in cannabis and actually can inform you. This particular lady, actually, it was her doctor who told her it's fine if you take the cannabis, but you must not take high dose THC with the cannabis. So I think do your research, find educated physicians who have an interest in cannabis so that they can guide you as to what cannabis you should actually be taking.
Okay, so your advice would be to all people who are now really hooked on, excuse the pun, hooked on CBD oils, or think that they can go out into their gardens and grow their own plants and then start, using it. Rather, do your research, know what you're doing, know how much to take in, how much to ingest, and be safe rather than sorry.
Absolutely. And there's nothing wrong with growing your own, but make sure that you're growing, if you need to be treating with CBD, you're using seeds that will give you a plant that's high in CBD. What people don't understand is there's this general concept in South Africa of this, RSO. It's a cannabis that comes in a small syringe, and a lot of people are not aware exactly what's in there. We also have to make sure that the sample has been tested. It's had a COA, a certificate of analysis, we call it, and this will show that there's nothing in that sample that's going to harm you as well. Not just the cannabis, the cannabinoids, the CBD, the THC. There's no other pesticides in there. There's no other forms of heavy metals or anything like that. If it's been processed, we need to make sure that it's being processed safely, that it's being processed with ISO, CEO compatible machines. So these are all the things that we're looking at when we're trying to up the usage of cannabis. Obviously, if you go to Discam or Clicks and you buy CBD, it's been, it has come in as an import, would have had a COA from other countries. So, it's relatively safe, but the problem is it might not be strong enough for you. It might not be the right ratio of cannabinoids that you need. So it will be okay, just like if you're going to take a vitamin, and it's not going to harm you, and it could be good for your prophylactic treatment. But if you're really looking for a specific treatment for a specific disease, then we need to really look at the specifics of what you're taking.
And that's where we have to leave it. Thank you indeed for being with us on the show this morning. Really, on Women's Day, we need to be hearing from women of your caliber to make us realize that we all have something great within us. We can follow our dreams and we can make a difference in the communities and societies we live in. Thank you indeed. Keep up the great work, and so nice talking with you.
Thank you very much. Jazakallah to everyone, and all of our listeners. Have a great day to all the women out there who deserve a day. Thank you.
Assalamu alaikum to you. That was Dr. Regina Hurley. She's based at the Newcastle Mediclinic, talking to us about her research and her treatment, one of them being cannabis oil treatment, or cannabis to treat COVID-19. 9/11 exactly. This is News and Views with me, Julie Ali. It's Women's Day. I hope that you're lying in bed being spoiled by your loved ones with possibly coffee and breakfast in bed. Take it easy. Enjoy the day. Enjoy your day, dear, amazing women all around the globe.